So let us continue our talk about basic concepts of community medicine. Today we will talk about the aims of a disease control mechanism, the differentiation between disease elimination and disease eradication, and various other topics. Now, talking about the aims of disease control, they include to reduce the incidence of any disease, to reduce the duration of a disease, to reduce the effects of that disease or infection, and to reduce the financial burden of that disease on the community as a whole. Now, talking about disease elimination and disease eradication. Disease elimination is a regional or local process. However, disease eradication, on the other end, is a complete, absolute, or global process. Disease elimination is defined as interruption of transmission of a disease at a certain area. However, disease eradication is defined as termination of all the transmission of that infection by complete extermination or removal of the agent that is responsible for that disease. Elimination of measles and polio from a large geographical area is an example of disease elimination. However, there is only one disease that has been completely eradicated, that is smallpox. So let us talk about natural history of disease. This is one of the most important basic concepts of community medicine. Now, natural history of a disease is made up of interaction of three components, which includes host, agent, and environment, and it consists of two phases. Now, let me explain this part of the chart first, and I will compare and contrast with the preventions. Now, this part is a susceptibility. Now, in this part, whenever the person or a patient is in this part, he is only susceptible of developing a specific disease, but he is not having any pathology. Then comes the pre-pathogenesis or preclinical phase. In this, there is biological onset of the disease that the patient has come through any means in a proper contact with the agent that is going to be responsible for that disease. Though pathological evidence can be found if only examined, but there will be no sign and symptoms yet. But at the end of this stage, sign and symptoms will eventually start to appear. Then comes the pathogenesis phase or the actual clinical phase. Now, in this phase, when the patient has entered, he or she will come to the doctor that they will ask for medical help, that something is wrong with their body, and they will require a proper diagnosis and eventually treatment. Now, talking about natural history of disease in terms of preventions. Now, when the patient is in the susceptibility period, primordial and primary preventions can be used. It has further two subdivisions which are actually the mode of intervention. They include health promotion and specific protection. I will go into detail of these at the end of this lecture. Now, then comes the pre-pathogenesis phase. In this phase, secondary prevention will be our line of defense, and it is further divided into two parts but in terms of mode of interventions, and that includes early diagnosis and prompt treatment. Though disability limitation is categorized by some authors under secondary prevention and by some other authors under the heading of tertiary prevention. Tertiary prevention can only be used in the pathogenesis phase, and it includes rehabilitation. Now, talking about, or rather comparing, the natural history of disease in terms of its infectiousness. Now, this is the point where exposure to that infection occurs, and it has latent period, infectious period, and non-infectious period. Now, latent period means the time period that is between the exposure and that actual infection to occur. However, on the other end, incubation period is that time duration in which the exposure and the onset of symptoms appear. Now, latent period and incubation period has a small overlap of this area, which comes under the category of infectious period, but it is not a clinical disease, as you could see. Now, how can we explain that? Now, explanation of this point is that, as we have learned from our pathology concept, that whenever a disease process starts to occur, they occur at cellular level, and then more and more cells and then tissues and eventually organs become involved, and various changes occur are at these levels, and eventually human being as a whole becomes affected. And when that human being becomes affected, there will be start of onset of symptoms, and that will be the clinical phase when the disease will actually appear. And when that disease has been treated, there will be resolution of these symptoms, and eventually the patient will recover. Now, talking about the epidemiological triad, the rationale of this triad is that whenever there is an interaction between the agent, the host, and the environment, only and only then a disease will occur. Now, going into detail of each of them, agent is defined as any substance, living or non-living, either their excess or relative lack may start a disease. So anything that starts a disease, be it living, be it non-living, be it in excess, or be it in deficiency. Now, there are biological agents which clearly shows bacteria, viruses, fungi, parasites, and many other. Nutrient agents include carbohydrates, fats, proteins, vitamins, minerals. Their excess or deficiency, as we all know, are responsible for certain metabolic diseases. Then comes the physical factors. They include heat, cold, pressure, humidity, and various other factors. And we also are aware that these factors have a great impact on our life. Then comes mechanical agents, which include friction. For example, friction in terms of crushing force, steering force can also cause damage. Then comes the chemicals. Endogenous chemicals include urea and bilirubin, and exogenous chemicals include metals. They are also responsible for causing a number of diseases. Now, talking about this host factors which are responsible for causing a disease or preventing a disease. They include demographic factors, for example, age and gender, biological factors, for example, genetics, the blood group, the enzyme, the type of personality someone has. Socioeconomic factors include marriage, education, and job, and lifestyle include habits, food, what type of food a person eats, and the amount of physical activity they have. Then talking about environment. Environment is divided into different types: internal environment, domestic or microenvironment, and external or macroenvironment, which is further divided into three types: the physical, biological, and psychosocial. By physical external environment we mean water, soil, climate, and by biological we mean the parasites, plants, and animals which are around us. Psychosocial environment is that in which we learn about different behaviors, how to interact with different people, how these interactions have a positive or negative effect on our health. Now, talking about different levels of preventions: primary level of prevention, secondary level of prevention, and tertiary level of prevention. So let us first define them. Primary prevention is any intervention that is implemented before the evidence of any disease. Secondary prevention is intervention implemented after the disease has begun but before it is symptomatic. Tertiary prevention is intervention implemented after the disease has been completely diagnosed and established. Each of these preventions has certain modes of interventions, and in primary prevention we have two: health promotion and specific protection. In health promotion, health education, good nutrition, personality development, marriage counseling, and periodic examination comes. In specific protection, immunization, personal hygiene, environmental sanitation, protection against occupational hazards and accidents come. Now, by health promotion and specific protection, primary prevention is given to the people in the areas where they are susceptible to develop a disease, so that we can actually prevent a disease from happening. As they say, prevention is better than cure. This is the actual example of this quotation in terms of medical sciences. Now then comes secondary prevention. Secondary prevention is applied when the disease has begun. Now you cannot do anything to prevent it, but you can do everything to slow down its course, and it includes early diagnosis and prompt treatment through screening and sampling, which is done through surveys. Now the objective is here to cure the patient and prevent the disease, and to prevent the spread of the disease to other people in the community, and also to prevent the complications that can occur as a result of that disease. Then comes the disability limitation, that what damage this disease can cause, how can we limit that? That includes adequate treatment and provision of facilities to limit any type of disability associated with any specific disease. Then comes tertiary prevention. Now, this prevention is applied actually to reduce the chances of developing any complications, or rather bringing the patient back to normal life after recovery. They include rehabilitation, which includes medical, vocational, social and psychological rehabilitation, so that the patient after recovery or during recovery can completely come back to their normal life, not only physically but also psychologically, and they can interact with other people despite being affected by a disease, because different diseases have different types of complications, and this also produces a psychological effect on that patient. So through psychological rehabilitation, the depression and various other components of psychological impact can be dealt with. Lastly, a very small comparison between these levels of preventions in terms of different components. Now, primary prevention has a population that is termed as whole or general population. As I have already explained, all the population which is susceptible to any disease can be prevented by primary prevention. In terms of secondary prevention, the population that will be included will be those who are exposed or those who are in the early stage of that disease. In tertiary prevention, the advanced disease patients or complicated patients will be included. Now, the goal of primary prevention is to reduce the new cases to occur, but the secondary prevention aims to reduce the severity and complications. However, the tertiary prevention is aimed at decreasing the impact and the death toll that will occur as a result if the disease is not properly dealt with. The rationale for primary prevention is to reduce the risk by reducing exposure. In terms of secondary prevention, if there is early diagnosis, there will be prompt treatment. In terms of tertiary prevention, the rationale is to reduce the impact of disease on the people so that there is less impact on them psychologically, physically, and economically. Then comes again a small overview of interventions. Primary prevention is done through education, and health promotion, and in secondary, screening, sampling, and early diagnosis and treatment, and in tertiary prevention, proper treatment and rehabilitation. Now, evaluation. Now, how we evaluate that whether these preventions are carried out in our community to a level that they actually are helpful, or they are just being done at a very low level that more efforts need to be put. Now, primary prevention is evaluated by measuring the incidence. If there is a reduction in the incidence of exposure, then primary prevention is working in our community. Similarly, if there is decrease in the incidence of the disease and decrease in the morbidity, then secondary preventive measures for that specific disease are working very well. Similarly, in terms of tertiary prevention, if there is decrease in the prevalence, morbidity as well as mortality, then we can say that the factors which we are using under the umbrella of tertiary prevention are actually working.